done on the face of the earth. Now, in fairness, not all Christians are silent. Earlier this week, actually a coalition of Christian, Jewish, and Muslim leaders launched a national advertising campaign backing health care reform in this country, calling it a fundamental religious issue. I think so. I want to know what you think. Is health care a moral obligation in this country? Text us tonight, will you? Text A for yes and B for no to 622-639. We'll bring you the results later on in the program. Joining me now on the program to discuss this is Bishop Harry Jackson, a senior pastor of Hope Christian Church and also author of Personal Faith and Public Policy. And also with us tonight, the Reverend Derrick Harkins, senior pastor at the 19th Street Baptist Church in Washington, D.C. Gentlemen, thank you for your time tonight. This is, I believe, a very controversial issue when it comes to the faith, because a lot of people just don't know where the Christian leadership should go on this. Bishop Jackson, is this such a moral issue that we should be hearing from Christian leaders and supporting the president in this country on this issue?
Well, Ed, you should be, but I think they've already been speaking out in some measure. First of all, I'm not for the president's approach. 3 years ago, I was diagnosed with cancer of the esophagus. I nearly died. If my care had been delayed or denied even 6 months, I wouldn't be here talking tonight. So I want you to understand that what people are dealing with is not just the idea that everyone needs to be covered, but the idea of how you're going to do it. If you diminish the quality of care in America, that's an issue. So what we have now is an open checkbook and an open set of prescriptions that have no directions. So I'm against it based on insufficient information. They got to come correct. They got to come with the information that makes a difference. And I, like many others, believe that someone's life is not worth more because they're worth less. And what I mean by that, the poor should have an opportunity to get health care, no question about it. But if you're going to slow down everybody else's health care, then I might be rich, but I've only got 3 months to live, and then I wind up dying because you have not specified the nature of your morality.
Bishop, I appreciate it, sir. I do disagree with some of it. Reverend Harkins, let me ask you, what would Jesus do if he were walking the face of the earth? What if we had the second coming of Christ in the middle of this debate? What would he say about the folks in this country who are going bankrupt because they have got a medical issue in their family, the hardship that families are facing? What would the Lord do?
Well, fortunately, and it's good to be with you, Ed, and with my good friend Bishop Jackson, one of the things that we can rest on is the fact that Jesus has already spoken about health care. In the 25th chapter of Matthew, he makes it very clear that we should have compassion, care, and concern for the sick among us. And I think there are two important things that need to be understood here. Before we get to clarity, there must be civility. And I think that one of the things that's incumbent upon Christian leaders to do is to implore those, and not just Christians who are at these town hall meetings, but any and everyone, that we won't get to that clarity if there is a profound lack of civility, as we've been seeing over and over again. And I hope and pray that in the coming days we'll have that clarity. You know, one of the things that's important also to remember is that we don't have a complete work of legislation here, but one thing we do know is that there's some key elements in all of the proposed portions that hopefully will come together quite soon as a piece of legislation. One is portability. If I lose my job or change my job, I'll be able to carry my health insurance. I won't have a discriminating precondition clause where if I've got a precondition that I'll either be denied.
But Reverend, that's my question. You know, we're getting off into the policy weeds here. From a moral obligation, as a Christian, Judeo-Christian nation founded on Judeo-Christian principles, why are the big four that I named here tonight, why are they silent on this debate? Why can't they come out and support the President of the United States to cover all Americans?
Even if they don't come out with the immediate support of the President, I hope they do come out with an understanding that it's an imperative, it's a moral imperative for people of faith to indeed have this as a front and center concern. So I would hope, aside from the politics, that they understand the healthcare system in America is broken. The healthcare system in America needs to be repaired.
And Bishop, does it bother you that it comes down to the God Almighty dollar in our society?
Well, it does bother me, but that is a reality. My concern, Ed, is that Dobson has come out and talked about this thing. A few days ago, there's a group that were on a webinar seminar with Family Research Council, 50,000 people gathered to talk about this within the Christian ranks. I believe, though, that we're dealing with the president saying his way is the only way, and I'm saying we need to slow our roll, make sure that we do the right thing so that people like me don't wind up dead. And I think the issue is in the details. You can't, just say.
I know we're having this discussion in this country, and we're going through the details right now, but from the moral obligation of Christianity, it would seem to me that we would be hearing more from Christian leaders, and I hope they do get engaged. Gentlemen, I'm tight on time. We've got some other things happening. I really want to bring you back. I knew that reverends and bishops coming on this program wouldn't be short of wisdom and words.
And listen, join us on Wednesday with the president on Wednesday evening at 5 o'clock.
Exactly.
Faithforhealth.org.
The president is engaging the progressive religious community to have a discussion next week on this.
I'd like to be in on that discussion.
And you can. Please, Bishop,
I would
join on the call.
I would too.
Faithforhealth.org.
Gentlemen, thanks for joining us tonight. I appreciate it very much, and we will have more on this story in coming shows as this debate continues in this